طبعا في الاول احب اشكر الاستاذ الدكتوره ايناس على دعوتي طبعا والاورجنايزنج كوميتي. شكرا استاذ الدكتور طبعا رأفت رشوان، الاستاذ الدكتور ابونا عطيه تشير بيرسونز، وشكرا على التقديم، وطبعا كل سنه وانتم طيبين للجميع. يمكن احنا لما بنيجي نتكلم بالنسبه للمانجمنت ان جنرال we are talking about evidence based. النية كويسة، لكن أهم حاجة إن يبقى الكلام دوت proved في الطب علشان الكوست بنفيت. يمكن أنا النهارده التوك زي ما كده طرح عليا إن أنا أتكلم فيه هو البري رمضان education outcome in diabetic patients. طبعا هي الفكرة جاية من إيه؟ الفكرة جاية من إن إحنا عندنا a large population of diabetes in the Islamic world. احنا تقريبا المسلمز about 1.9 بليون، على اعتبار ده اللي هو التوتال 25% من التوتال او الجلوبال بوبيليشن. لو قلنا 10% بريفالنس تايب 2 90%، يبقى احنا عندنا اكتر من 150 مسلمز with diabetes in the world Muslim population. Actually many Muslims with diabetes choose to fast during Ramadan. لو جينا نشوف الداتا بتقول لنا حوالي 40% more than 40% of type 1 diabetes try to fast during Ramadan. ويمكن الدكتورة طبعا شيرين illustrated this intention. وعندنا almost 80% of people with type 2 diabetes fast during Ramadan. As we see here حوالي 80% fast more than 15 days. تقريبا 75% بيمنتين الاورال انتي دايابيتيك تريتمنت، وحوالي 64% بيمنتين الانسولين دوزج. What are the challenges with Ramadan fasting in patients with diabetes؟ احنا كلنا عارفين، هو صحيح الدكتور هشام ورانا البينيفيتس اوف فاستنج على مستوى الهيلثي بيرسون، بعيد كمان عن مجرد الريليجيوس يعني fact في الموضوع. لكن احنا عندنا there are many key risks associated with Ramadan fasting in people with diabetes: the hypoglycemia, the hyperglycemia, thrombosis and dehydration. طبعا الفيمس EPDR study اللي هي epidemiology of diabetes and Ramadan اللي كانت فيها حوالي 13,000 type 1 and type 2 diabetes showed that there is a high risk of severe hypoglycemia events in all populations. زي ما احنا شايفين، وكان في type 2 يمكن كان 7.5 fold increase في الهايبوغليسيميا. Again increase high risk of severe hyperglycemia with or without DKA in patients with diabetes compared في رمضان compared to pre-Ramadan education. So there's a real risk with fasting. Another challenges, many patients and challenges for the physician and for the patient. Patients often choose to fast during Ramadan. ويمكن شفنا type 1 diabetes زي ما الدكتورة شيرين قالت لنا. Patient reluctant to self-monitor during Ramadan. Some patients may stop treatment altogether. So يمكن احنا عارفين وشفنا العيانين بتوعنا يجي يقول لك انا عارف انا بوقف الدواء ده لان انا عارف ان انا لما باخده السكر ممكن يهبط، وبالتالي ده هيخليني افطر، وبالتالي هو لما بيوقف الدواء بيبقى عارف ان هو هيقدر يكمل صيامه without risk of hypoglycemia. مش بس كده، unwilling of self-treated hypoglycemia by breaking the fast. احيانا بعض الناس بيبقى عندها some sort symptoms of hypoglycemia لكن هم insist to fast. زي ما احنا شايفين most patients do not break fast during feeling hypoglycemia. حوالي 14% بيبريك، وحوالي 85% try not to break with the symptoms of hypoglycemia. يجي السؤال: can a diabetic patient fast Ramadan؟ يمكن احنا المين بالك لو احنا بنتكلم على type 2 diabetes، the bulk of literature indicate that fasting Ramadan is safe for the majority of type 2 diabetic patients with proper education and diabetic management. هنيجي نلاحظ هنا patient report intentions to fast and actual number of days to fast. هنلاقي تقريبا الانتنشن تو فاست بيمثلوا 96%. لما نيجي نشوف الفترات اللي صاموها ايه، هلاقي 60% صاموا الشهر كله، حوالي ربع الناس صاموا من 3 ل 4 أسابيع أو من 21 ل 28 يوم، و8% صاموا من 11 ل 20 يوم، وفي بعض الناس صامت few days. So the intention of most is to try to fast. طب how we can fast with safe, and what's the evidence of safety fasting and the evidence of benefits of a Ramadan focused diabetes education. حقيقي many trials across different Muslim countries done، لكن من أول الاستاديز اللي اتعملت كانت الريد program أو Ramadan education awareness in diabetes for Muslims with type 2 diabetes، ودي كانت conducted في ال UK، وخدوا ال GPs based in London attended educational program and diabetes workshop to gain understanding of the issues surrounding diabetes and fasting. These GPs provide a 2 hours pre-Ramadan education program for the patients, and again the patient attended a group session led by a specialist dietitian with diabetes specialist nurse practitioner. This is the important objectives of the READ program. عملوا رمضان focused education، بصوا على الميل planning with dietary advice اللي هي dietary during Ramadan should not differ from healthy balanced diet، يعني اللي يبقى healthy balance طبعا بعيد عن الفيست اللي احنا طبعا pattern of fasting أو breaking fast بعد اليوم الصيام، to encourage slow energy released food and to minimize the food high in saturated fat. Again, for exercise to take light and moderate exercise on a regular basis and to avoid rigorous exercise during evening times because of the risk of hypoglycemia. وعندنا medical assessment اللي هو encourage the patient to seek medical advice من ال health care providers before Ramadan to adjust ال medications زي ما احنا شفنا في الحالة أو بعض الحالات اللي قدمتها الدكتورة شيرين. Another points of education, the diabetes related اللي هي blood glucose monitoring is very important. Again, recognizing and management of the complication, how to recognize the major symptoms of hypo and hyperglycemia should be educated, how to manage hyperglycemia, for patients safety to stress the need to break the fast when hypoglycemia and encourage the patients to seek medical advice for any other complaints. Actually, the benefits of the READ program was from the results. It showed that there is a significant loss of weight compared with before Ramadan. We can statistically significant for people in comparison ما بين الانترفنشن والكنترول جروب، وعملوا sustained glycemic control للعيانين اللي خدوا الريد education، عملوا sustained glycemic control for 1 year those who attending the program. And the most important that the risk of hypoglycemia لما نيجي نشوف الناس اللي هم عملوا education can reduced too much compared لل patients with no educations، وكان تقريبا حوالي 4-fold reduction في risk of hypoglycemia with education. Another trials طبعا دي بعد كده في many Muslim countries زي ماكون ترايل كانت 772 على تايب 2 دايبيتس، كانت موجودة في ايجيبت، ايران، جوردن اند كينجدم سعودي ارابيا، وكانت بري رمضان education versus اليوجوال كير، وكان الاديوكيشنال انترفنشن 2 months قبل رمضان to individualize half to 1 hour educational session delivered appropriately by a trained dietitian and diabetes specialist. And it showed again a significant benefit of the educational program for patients who can modify their treatment plan, perform self-monitoring of blood glucose, know the signs and symptoms of hypoglycemia, report mild and moderate hypoglycemic events, but fewer reports of severe hypoglycemia still occur during Ramadan. Another trial from Ain Shams Diabetes and Endocrine Department by our colleague Dr. Ayara Eid and her colleagues, the empowerment-based diabetes self-management education, maintaining a glycemic target during Ramadan fasting in people with diabetes on conventional insulin. Conventional insulin, the human insulin. It was a prospective trial. Over 14 patients attending Ramadan reinforcement session in the educational program in Ain Shams University Diabetes Center. The aim to assist the feasibility of safe Ramadan fasting through diabetes self-management education and determine the effect of education on hypoglycemic events. The diabetes self-management session started 2 to 3 weeks before Ramadan and included one experimental day fasting during the first week and one during the second week اللي هو في قبل رمضان. يعني وده من ضمن الحاجات المهمه اللي الواحد بيعملها. لقوا ايه في الريزلتس؟ لقوا ان احنا بالنسبه على مستوى الجليسيميا راح حصل امبروفمنت في الفراكتوزامين كطبعا شورت مونيتور بالنسبه للجليسيميك كنترول، وعملوا significant benefit reduction في الهايبوجليسيميا during رمضان بالنسبه للبيفور رمضان. The conclusion that Ramadan fasting is feasible for people with diabetes who are on multiple daily injection insulin regimen. The number of hypoglycemic events per month was declined or decreased. Another trial, Dr. Lubna Touni and her colleague, the outcome of focused pre-Ramadan education على metabolic and glycemic parameters in patients with diabetes, again prospective 120 في الانترفنشن وطبعا الكنترول، وكان الانترفنشن عملوا لهم education وكان البرايمري outcome على الهايبوغليسيميا والبايوكيميكال parameters، وقالت لنا ان في less hypoglycemia during fasting compared في الانترفنشن compared للكنترول. نفس الكلام حصل more people maintain the A1C اقل من 7 والليبيد بروفايل also. دكتورة إيناس شالتوت and again and colleague ده كان برضه في 2020 in another trial culture based pre-Ramadan education في prospective trial كان على حوالي 1008 offered culturally adapted and it showed again patient received pre-Ramadan education program had a lower HbA1c and also showed a reduction في weight compared to those receiving the usual diet، وكانوا عندهم chance to have a more prayer time للتراويح و improved perception والresponse للhypoglycemia. Again significant statistical improvement على مستوى A1C والchange مع education. The positive impact is evident على Ramadan focused education. Pre-Ramadan educations will greatly have an impact على glycemic control, better self-monitoring of glucose treatment management, sustained motivation in adhering to the guidelines, and they have a greater empowerment to fast safely during Ramadan. Actually, the education should target the healthcare professional, and this is important, the one who will give the education, people with diabetes, the patients, and the general public لأن عشان to keep talking the same language about the risk and the education. This is the key component of Ramadan focused education program: risk stratification and exemptions and removing misconceptions, blood glucose monitoring, fluid and dietary advice, physical activity exercise advice, medication adjustment and test fasting, when to break the fast, recognition of hypoglycemia and hyperglycemic symptoms. To conclude, studies have demonstrated clear benefits of Ramadan-focused educational program on glycemic control, weight loss, and improving the risk of hypoglycemia potential even in high-risk individuals. The positive outcome of these programs may also extend beyond the months of Ramadan fasting. Pre-Ramadan education is a key component of safe fasting during Ramadan for people living with diabetes. Pre-Ramadan education programs should target people with diabetes, healthcare professional, general public that serves as the support network. Thank you very much for your listening.
Thank you,